We continue our series for the children. Pacifiers, thumb sucking, the bottle, the blankie, they can make parents' lives easier. But when is it a good time to say goodbye to these comforts? Joining us today to discuss weaning your child off of habits is Dr. Michael Ramsey. Thank you for coming by, Dr. Ramsey.
Thanks for having me today.
Now, these are all very common things that children like to attach to when they're babies.
Right.
What is the rule of thumb, no pun intended, for parents to start weaning their kids off of these items?
Right. There's not a hard and fast rule, but what most people recommend is around a year of age is to start working on getting these type of behaviors under control. You know, the pacifier is something that can be very helpful, and there are some studies that show that in the first 6 months of life that pacifier use will decrease the incidence of SIDS. It helps during medical procedures like shots and other things like that. But when the pacifier becomes a problem is when, instead of the pacifier helping the child from crying, that the child starts crying for the pacifier.
Now, how old have you seen children continue with pacifiers, and when is like an absolute cutoff age?
Right. Well, this fall I was at a ball game and kids were running around and up and down the stairs, and I saw a 4-year-old running up the bleachers with a pacifier in. And so I really said to myself right then, this is a big problem. And so one of my New Year's resolutions for the year was to really concentrate with my patients on how to get rid of the pacifier. And so usually it's harder the older you are, and so I would say around 18 months would be the latest that I would recommend. Some kids, if there's a stress in the family or a big change, I can see a problem with that, and so because it does help soothe those behaviors. But over 2 really needs to get rid of the pacifier for sure.
Okay, now kids I'm sure experience some sort of separation anxiety when it comes to these items being taken away from them. Is there a good way for parents to start weaning them off?
Right. The first thing I would say is to try to restrict their use to bedtime, nap time, and then if they are undergoing a procedure like getting shots at the doctor or something like that, or with an illness. A child should probably never be just sitting playing happily with a pacifier in their mouth. And so, and also if the pacifier falls out, the parents run to put it back in. They don't need to be doing that either.
Okay, what about thumb sucking? If the pacifier is taken away and they replace it with thumb sucking,
Right.
What are the dangers of letting a child continue to suck their thumb?
Right, thumb sucking is a little bit harder to get rid of, and most kids have a preference for either the pacifier or the thumb. Very few will go from the pacifier to the thumb, so that's a blessing. But when kids are thumb sucking, you know, there's lots of different methods. People will say keep a mitten on their hand or put something that's bitter tasting on their thumb. Most of those don't work. It really is a consistent message from the parent that that's just not something that we do. It takes about 3 weeks of constant going to either make or break a habit. That holds true for adults as well, and you can translate that down to children. And so if a parent is really diligent with thumb sucking, for about 3 to 4 weeks, they can break that habit.
And also, can thumb sucking also alter a child's bite or their teeth structure?
Absolutely, and so that pressure that they constantly press on the palate will pull the teeth forward, and so to save on orthodontic bills when they get older, we need to stop that habit early.
Okay, thanks Dr. Ramsey.
Thank you.
And if you have any questions for the children, you can email us at morning@WTVY.com. Also, if you'd like to watch this interview or any of our past interviews, you can log on to our web channel at WTVY.com and click on For the Children.
Stay with us. I've got one final check of your forecast when we come back, plus